Hey guys, it's Allie. I just wanted to do a quick video on to touch base on home health nursing and hospice nursing during this crazy virus thing. Also wanted to do a huge shout out to all the healthcare professionals who are on the front lines, the true boots on the ground, as we would call them, and who really aren't being cared for. That's just, they're not being cared for as they should. And we were taught proper PPE and when we should use them and why we should use them, and now everything that we ever learned on evidence-based practice, why we should be doing this stuff, has been thrown out the window due to lack of supply, which is not okay. It's really just not okay, and it's not safe. And I just want any nurse to feel that if they want to lean out at this time during the virus because they don't feel safe, and because they might have an immunocompromised loved one at home, or an elderly loved one at home, or somebody who's at risk of getting this virus and passing away from it potentially. If you feel like you have to lean out, there's no judgment. There shouldn't be any judgment. And any nurse who judges anybody for bowing out to protect them or their family because they're not given proper PPE, you should be ashamed. Nobody should be a sacrificial lamb during this time, and we should all be supporting each other, whether you stay on the front lines or whether you decide to lean out for a little bit just so that you're protecting you and your own. Everybody is doing what they feel they need to do and really doing their best just to kind of, make things work. And everybody has a huge amount of anxiety, fear of the unknown, and we're all just trying to do our best for ourselves and also our families and patients during this time. But in the end, you really do have to think about your family first. They're the ones who you're coming home to. And I know a lot of first responders and frontline workers aren't even going home to their families. Some people are staying away. Some people are sending the kids to the grandparents during this time. And I think those are all very smart decisions. And some people can't do that. And my heart goes out to you if you can't. And I would say we're all in this together, but I sound like one of those celebrities who is talking from their house, from their mansion, which I don't live in a mansion, that's for sure. But everybody's going through their own battle when it comes to this whole virus, and it's scary. So I appreciate everybody, not only the healthcare workers, the teachers who are trying to figure out Zoom classes and online learning, the truckers, the grocers, the pharmacists, everybody who's deemed essential right now, who is basically being put on the front line and facing this scary time, all because they need to make a profit for somebody else. Anyway, moving on. Hi, babies. You want to say hi? So I just wanted to touch base on hospice nursing and home health. I'm going to do a little bit because I've never been a home health nurse. I know it doesn't really vary too much from hospice, except the end goal is a little bit different. So a few things. I know some agencies are not supplying N95 masks. I know they're in super short supply right now. If you feel like your patient is a potential COVID-19 risk, it's okay to not feel safe without an N95. That's truly the only protection you're really going to have from getting it yourself. I know in Massachusetts, our governor has issued a suggestion. Everything's a suggestion in Massachusetts right now to wear masks if you're taking care of an at-risk, if you're, an at-risk patient or loved one, just to protect them. But your company, if you are dealing with a known COVID-19 patient, you should be wearing an N95, period. There's no exceptions. That's just how I feel about it. Now, a lot of us are wearing masks to prolong them a little bit since they're in such short supply. So wearing surgical masks over the N95, putting the N95 in a paper bag after, just to prevent it. Now, it does make it a little bit stuffier. I've worn a surgical mask over my N95, and it's not super comfortable, but it's something that you have to do. And you also have to take it off properly as well, so that you don't contaminate the inside. And I'm kind of thinking of trying to develop some sort of container where I can hang it inside, so that way it doesn't have to touch anything. So I don't have to worry about the clean side touching the dirty side, the clean side of the mask touching the dirty side of the bag while I'm driving around, because it's not like we're putting them on a table. We're putting them inside our car and we're going down all these kind of side roads. So another thing to keep in mind always is always be using your barriers. Try to take, really? when you have little ones. Even though I wouldn't call myself a YouTuber, but.
There.
Ew, this stuff stinks. So, of course, keep doing your barriers in between all of your, everything you keep in the home, your bag, your laptop, your tablet, whatever you have. Keep doing that, of course. And in your car even, have barriers between your stuff. Have barriers between you and your seat if you really need to. Whether you're using trash bags or whatever you want to use, any sort of barrier will work. So another thing I've heard of some people doing is taking less into the home as possible. Whether that's G-tube, J-tube, catheters, flushes, anything like that. And anything like that. So you can figure out how to do that and maybe get a smaller bag where you can, just keep it as a kind of a satchel around you. Or I had one person on Instagram tell me that she's going to try to use a fanny pack that she got offline. They do actually make, I think it's Hopkins, they make a medical fanny pack. I don't know if it's necessary, but it might be a little more, they might make it with a little more durability than some of the fanny packs you would find at like Target. Another thing that I do is I wear layers of gloves, maybe double layers of gloves into the home. Of course, you want to wash your hands before every visit, but you still have to touch all the doorknobs to get into the home. And every time I go into a home, without fail, it seems like you always need to help with something. Someone's always trying to get up. Someone's always, can you do this? Or someone tries to shake my hand. I probably would go through a pair of gloves just entering the home. And then I wash my hands, and, you just want to be as protected as possible. And unfortunately, during this time, that patient touch might not be as, you might not be able to do that type of connection as much during this time, just because a lot of patients and their families are fearful. They're fearful that we're going to be bringing it to them and their loved one, and I completely understand that. So we want to show them that we're trying to protect their loved one as much as possible from at least us giving it to them. So, like I said, wear an N95 mask if you can to all of those high risk patients, and for low risk patients, a regular surgical mask would do. And these are just kind of my opinions. They're not really based off of necessarily what my company's doing or other companies. And like I said, I know supplies are in short demand and not a lot of nurses are getting them. And then there are some hospices and home health agencies that are really stepping up and have been doing N95s and masks since the whole start. Another thing that if your guys aren't doing it already, you might want to start pre-screening patients if, your managers let you, or whoever is at the top. Start pre-screening patients, asking, all those questions like, has anyone in your home been out of the country in 14 days or have flu-like symptoms or cold symptoms, fever, etc., things like that. So you can be prepared when you go into the home on what to expect and how to protect yourself. Another thing is, and it's not always applicable, but, we have laptops at my job, so those are very different and they're hard to clean effectively versus a tablet you can kind of wipe down really easily. Laptops have a lot of keys, holes, crevasses, all those types of things. So sometimes I try to do some of the charting outside the home because it just makes me feel safer. Whatever I can do outside the home, I will. And I know that's not a great use of time management, just trying to keep everybody safe. And it's trying to keep myself safe too, because if everybody gets sick and all the nurses get sick, what are we going to do? I think 5 minutes to chart a little bit more outside the home and do certain things outside the home is better than potentially exposing a ton of other people. Of course, always wipe everything down before and after visits. Other thing I know a lot of agencies are doing, at least in hospice, is decreasing the face-to-face visits, unless it's for symptom management or it's an emergency. They're doing a lot of calls, and they've actually come up with templates so that people can do visits over calls. I know that in hospice we have to do one visit at least every 2 weeks. So that's what's being done at minimum, if we can. And then the other thing that we are doing also is taking temperatures. A lot of people I know are taking temperatures before they start their shift or even before every patient. Even when you go into certain facilities, you probably notice they're taking your temperature, and asking you all the pre-screen questions. So everybody's doing it. So why shouldn't home health and hospice, right? Lysol spray. It's always good to just spray everything down inside your trunk, including your bag, maybe yourself. I don't know. Do it in an open air place. You know, what I'm saying is not gospel, but it's what I do because it makes me feel a little bit better. I don't know if it works. You know, another problem is also hand washing in and out of homes. Always bring your own soap and your own paper towels. It's something we're supposed to always be doing anyway. More so now, don't rely on the patient and their family to have soap in their homes because you just never know. The other thing that I do is I buy my own alcohol wipes for myself normally. Doing is actually alcohol wiping my cuticles. And I have wooden sticks. I'll show you. I have some in my home, but I have these kind of disposable wooden sticks that I've been using at the end of every shift, or if I feel like I need to, and I just clean under my fingernails with that. I keep my fingernails short anyway. Broken cuticle. I would recommend doing some extra cleaning because those germs tend to stay in your cuticle area and where you have eczema as well. Also, something that I invested in a long time ago was steering wheel covers. They sell on Amazon plastic steering wheel covers that they use at car dealerships and things like that. I find that they can be a little bit slippery, so you have to be careful. But usually I just drive on the inside of my steering wheel anyway. But my thing is, it's still just another layer of protection for me, at least. If there's something else that you feel like you can do, let me know. And something else that I do is I've said this before, I keep my phone and my keys in separate Ziploc baggies for during the day so that I don't have to touch the screen, and it eliminates from having the germs on there at all. So I don't have to worry, oh, did I clean it good enough? When I get home, I literally just dump it out of the bag. I throw the bag away and then I go wash my hands. Or I use clean pair of gloves to dump it out of the bag. The last thing that I'm going to suggest is just carry extra of shirts, pants, things like that. Because, we're not really, from what I can tell, in my online research, Google University, I don't really figure it out how long this thing lives on clothing and materials. We know how long it lives on plastic surfaces in a perfect environment and other metal surfaces. Just don't know. I always bring extra clothing. It makes me feel a little bit better. And I'll do anything to decrease my anxiety at this point. And of course, when you get home, leave your shoes outside. Most of us probably already do that. Some people are disrobing outside. I don't disrobe outside, but I do roll up my pants when I get in so they're not dragging across the floor. So clean, or if my pants are a little bit long, which they're not right now, but they have been in the past, I actually will tuck my pants into the back of my shoes so that they're not dragging on the floor and picking up anything, because whether you're going into a facility or a person's home, just never know what's on the floor. For at least home health and hospice, I think it's a little bit scary because in hospitals and facilities, they're restricting visitors. There's no visitors unless maybe it's an emergency or they have one person. But when we walk into a home, we have no idea who's been in and out of that house. They could have had visitors from anywhere, and you just don't know where they've been. But we do have to rely on people being honest. It's very hard to do that, to rely on other people to basically protect you. Because not everybody's going to be watching out for your best interest. And right now, it doesn't seem like in this situation, anyone's, watching out for people in healthcare. They're not watching out for their best interest, obviously. And it's very hard to do that on your own as a visiting nurse, because you really have to hopefully rely and you have a good relationship with your patients to be honest. But I can definitely see how some people might not be as upfront if they still want their loved one cared for during this time. And all I can say is, if you can educate your families on what's going on right now, and look at this silly string, you can have a conversation with them about how it's really important during this time to minimize excessive visitors. I know in hospice, it might be a little bit harder because of the nature of it. If somebody is transitioning or actively dying, are you going to say, no, you probably shouldn't have people over? Probably not, because obviously everyone in the family wants to say goodbye to their loved one. You have to be very mindful that you also have to be well and healthy to see other patients and to go into other homes. So you really, truly not only have to look out for your best interest, but also those of your other patients. So if you feel like someone you're seeing is practicing unsafe measures right now, like huge family gatherings, or really going out in public unnecessarily, or not practicing social distancing and bringing sick ones around the compromised patient that you're seeing. I think you have to go by your best judgment and of course what your agency is doing. And I would definitely talk with my manager if I felt unsafe going somewhere. It's an uncertain time for a lot of people. And we're going to try to do our best to make our patients and their families feel as comfortable. And we also have to feel comfortable ourselves. We got into nursing to do all of these right things for our patients and make sure that everyone's safe and take care of them. And it's very hard to do that not knowing if you're asymptomatically carrying a virus or somebody else is asymptomatically carrying a virus, and then you go and see them. I think a lot of nurses are having anxiety about that and potentially bringing it home to their families, but we're hopefully going to come out on the other side of this okay. And my heart goes out to everybody working in the ER, the ICUs, the respiratory therapists, the aides, of course, the ones who do really intimate care on patients, only ones that are keeping this whole thing running, and all of us are trying to work together and make it better. And it's hard to keep that positive attitude and a smile on your face with this. I think the main thing that I do is I just take it day by day, and I always know in the back of my mind that at some point this will all be over. Yep. Things are gonna change. They have to change, and if they don't change, well, as a nation of nurses will make a change. After the dust settles from this whole thing, healthcare really needs to reevaluate their priorities because they were messed up before. No. Look at my water bottle standing on my mug. So stay strong, everybody. And, I hope this helped out a little bit for my home health and hospice nurses out there who are really uncertain about the time. I don't know what your agencies are telling you to do. I know some are saying you don't need to wear masks at all. The CDC isn't recommending masks. Just go by what your state is doing as well. I know our state is recommending us to wear masks around, as caregivers if you're working with an at-risk patient. They're recommending masks. I mean, you can't... Really, are we going to say we're not going to go by what the CDC says, or we're going to go by what they say? Because look at what they're doing. They're backtracking a whole heck of a lot. You can't even rely on them right now. No offense, CDC. Go home. You're drunk. Okay. If there's anything else that you guys are doing in home health or hospice that, is to kind of prevent the spread more than we already have, all of the things that we're taught normally, we have to just keep doing them. But now I feel like the awareness is heightened a little bit because this is different than anything that any of us have ever approached, at least from my standpoint. So I hope you guys have a great day. Just try to keep doing your best and know that your best is enough right now. But I'm hopeful for the future because I know, like anything else, just like when we had Ebola and SARS, we all just came out on the other side of it. And we're going to have to all band together and fix the problems, because if this happens again, we cannot face pandemics like this. This is insanity. It's unprofessional. It's terrifying. And you're putting the biggest risk of, the biggest group of people you need to fix the problem, the healthcare people, you're putting us all at risk for what? So don't forget to follow me on Instagram. I also always do some updates on there, and I always kind of do little shout outs to the community. Okay, she wants to say bye. Bye. That's my little one. So that's really who I'm trying to stay healthy for, is my little one and also my elderly parents. So keep in mind that we're all human here. Healthcare workers are not superheroes. We may be heroes to some sort in some people's eyes, but we're not superheroes and we're not invincible. So none of us have to be martyrs in this whole thing either, or sacrificial lambs. So like I said before, this is a judgment-free zone if you feel like you need to lean out at this time. All right? And you are more than welcome to come back. I promise. Have a great day, guys. Bye.